I thought I'd start just by emphasizing, I think what we all know, that this pandemic is the most serious public health crisis that's confronted both our nation and the world in more than 100 years. And we are now at this moment in time really at a very significant moment in the pandemic, particularly in the United States, where we're seeing widespread transmission throughout our nation. Just to highlight, we had over 4 million cases in the month of November alone, more than 1 million a week. And we're consistently seeing between 175,000 and say 225,000 cases a day. It's also very sobering to realize that in the United States today, that COVID-19 now is the leading cause of death, surpassing heart disease and other causes of death.
The confirmed daily death toll from COVID-19 exceeded 2,000 for the second time, and the third, and the fourth, and the fifth, and the sixth. This past week, COVID was the leading cause of death in America.
Donald Trump has maintained that while United States has the most number of cases of coronavirus, he says that it's a badge of honor.
We haven't lost anybody yet, and hopefully we can keep that intact. There have been no deaths in the United States at all.
And the 15 within a couple of days is going to be down to close to zero. That's a pretty good job we've done. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. You have to be calm. It'll go away. It will go away. Just stay calm. It will go away. We need a little separation until such time as this goes away. It's going to go away. It's going to go away. It will go away. You know it is going away. And it will go away, and we're going to have a great victory. It's going to go away, hopefully at the end of the month, and if not, it hopefully will be soon after that.
Back in late February, you predicted that the number of cases would go down to zero. How did we get from your prediction of 0 to 1 million?
Well, it will go down to zero ultimately. Typically, that will go away in April. It's going away, and it is going away.
You were saying things like, I think it's a problem that's going to go away within a couple of days.
It will go away. But I think what happens is it's going to go away. This is going to go away. It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated.
That you bought yourself some time and you didn't use it to prepare hospitals. You didn't use it to ramp up testing. Right now,
you're so disgraceful. It's so disgraceful the way you said it.
What did you do with the time that you bought?
Look.
So I said to my people, slow the testing down, please.
You know you're a fake. You know that. Your whole network, the way you cover it, is fake. We've done this right, and we really have done this right. The problem is the press doesn't cover it the way it should be.
So I said to my people, slow the testing down, please.
We are cutting into what was not a White House coronavirus task force briefing. I am Ari Melber. Our special coverage continues. We are going to avoid airing any more of this White House briefing until it returns to what it was supposed to be, which was the coronavirus task force providing medical information.
I saved hundreds of thousands of lives. A lot of people are getting better, very much better.
My question for you is, why is the U.S. leading the world in deaths?
You know, it's obviously an excellent question. It's kind of a sad answer, and I'm going to give you the answer. I do think your point is important. As I was talking to the Chamber of Commerce the other day, we are in the time frame now that probably for the next 60 to 90 days, we're going to have more deaths per day than we had in 9/11 or we had at Pearl Harbor. I mean, this is really, as I said, this is going to be a real unfortunate loss of life, as all that we've had so far. And the reality is the vaccine approval this week's not going to really impact that.
Essentially, we've only had 15, and a lot of that's because I called it early. Now the Democrats are
Politicizing the coronavirus.
And this is their new hoax.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
This is their new hoax.
Dr. Fauci said earlier this week that the lag in testing was in fact a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all.
So I said to my people, slow the testing down, please.
It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows. The fact is, the greatest experts, I've spoken to them all, nobody really knows.
We will have coronavirus in the fall. I am convinced of that.
Now the Democrats are politicizing the coronavirus. And this is their new hoax.
You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No.
President Trump downplaying the threat of a second wave of coronavirus cases, despite warnings from his top public health experts that COVID-19 is likely to come back this fall.
It goes out, and it's going to go out fast. We're going to be watching for it. But it's all possible. It's also possible it doesn't come back at all.
We will have coronavirus in the fall. I am convinced of that.
The U.S. has suffered its deadliest day yet from the coronavirus. More than 3,000 deaths were linked to the virus yesterday, topping the previous record set just 6 days prior. According to NBC News data, California, Illinois, and Pennsylvania all recorded more than 200 deaths yesterday, while Colorado, Idaho, North Dakota, and West Virginia broke records. The U.S. also reported its highest number of new infections yesterday, nearly 223,000 new infections, with Texas, California, and Ohio leading the way. Willie, these are horrendous numbers.
Yeah, 3,000. When we hit that number, a little under what we saw yesterday on 9/11, it completely changed the way we live. Let's see if that happens here.
CDC Director Dr. Robert Redfield raises concerns that President Trump is sharing incorrect information with the public because he's being pushed by a new member of the coronavirus task force. Redfield is particularly worried about task force member Dr. Scott Atlas, you see him there on your screen, telling a colleague in a phone conversation overheard by NBC News, quote, "Everything he says is false."
Dr. Redfield was essentially saying that he doesn't support Dr. Atlas's views on many of these topics and that they make their way to the president and then, of course, ultimately to the public. So when we deplaned in Washington, I spoke to Dr. Redfield. He confirmed that that is indeed who he was talking about.
These people are truly morons. You know what I mean? And I like how they go after Scott Atlas because he's not an epidemiologist.
So moments ago, this story breaking that Dr. Scott Atlas, President Trump's special advisor on the pandemic, has resigned his post.
I mean, give me a break, Laura. The reality is this. If you look, I put it up on my Instagram a couple days ago because I went through the CDC data because I kept hearing about new infections. But I was like, well, why aren't they talking about this? Oh, because the number is almost nothing. Because we've gotten control of this thing. We understand how it works. They have the therapeutics to be able to deal with this. If you look at that, look at my Instagram, it's gone to almost nothing.
Robert Redfield, the head of the Centers for Disease Control, says December, January, and February will be the most difficult time in the public health history of this nation.
I do think, unfortunately, before we see February, we could be close to 450,000 Americans have died from this virus.
On to the issue of the holiday spread and the peaks, they're going to be superimposed upon each other. So you would expect the full blunt of the travel and the family setting gatherings with friends that you alluded to as being a problem. You'd expect that the effect of the Thanksgiving surge would be probably another week and a week and a half from now. So I think not only for New York State, but for any state or city that is facing similar problems, without substantial mitigation, the middle of January can be a really dark time for us.
I've said that the next 3 months in the United States in particular is going to be really rough. And I've actually said, it's my own personal belief, it's going to be the most difficult time in the public health history of this nation. This is why we're really asking people to really double down on the mitigation steps that we do know work. There's really no value in the debate about whether these mitigation steps work or not. They work. We have the data to show that. We're asking people to wear a mask. They work, they help contain the virus from the individual infected so they don't spread it to others, but they also can impact whether or not someone who's not infected gets infected. And it's critical that we embrace mask wearing, social distancing, excellent hand hygiene, smart about crowds, recognizing that outdoor is better than indoor. Ventilation is really important. This virus doesn't do well in highly ventilated spaces in terms of its ability to transmit. We're also asking people to be very circumspect this holiday season about traveling. We believe the safest place for people right now, at least in the United States, because of the extent of the pandemic, is to seriously reconsider travel plans.